Hello and welcome to Leaders for Health plus Social Good. I'm Vismita Gupta-Smith, and today we're going to talk about the need for investment in preparedness for emergencies, all kinds of emergencies. This region, the WHO Southeast Asia region and its 11 member states, amongst them have the highest burden of global deaths due to disasters and also experience a number of outbreaks. How are governments preparing their health systems, their people, and where are they investing so that they can reduce the risk for investment? On the panel with me today, on my left is Dr. Poonam Khetrapal Singh, WHO's Regional Director for the Southeast Asia region. I also have the Health Minister of Indonesia, Dr. Nila Moeloek. And on my right here is Dr. Phusit Prakongsai. Dr. Phusit is the Director of Bureau of International Health in Thailand. I would like to start with you, Dr. Poonam Khetrapal Singh. Could you please explain to us the need for investment in preparedness for all kinds of emergencies?
What you said before is so right, that this is a disaster-prone region. And if we look at the mortality from disasters in this region, from the World Disaster Report, which reflects the last 10 years of mortality, we find that the highest is from this region. And therefore, we feel that preparing countries and building capacity in countries to deal with disasters is of paramount concern to us. We have been trying to do this more so aggressively after the tsunami of 2004, which affected 6 countries of our region, most of all Indonesia, where we had almost 175,000 deaths. And that also we used as an opportunity to advocate with our countries to have national disaster preparedness authorities and also to build capacity within their communities, within their people for handling disasters. All this needs investment in financial resources, investment in human resources. We need to train people. We need to see that, yes, they are prepared to deal with an emergency situation when it comes. All of us know that we cannot predict emergencies. They just come. If there's an earthquake, it just happens, as we saw in Nepal lately on the 25th of April this year. If there is a flood, it'll just happen. And we've seen that this year also. We've seen it in Bangladesh, in Myanmar, and now in DPR Korea. So we do have these kind of natural disasters. You name it, and we have it. We have typhoons, we have cyclones, we have earthquakes, we have a tsunami also, and we have volcanic eruptions as in Indonesia. So therefore, for us, this is of paramount importance. We also, after the tsunami, established a unique fund, which is called the Southeast Asia Health Emergency Fund. And this fund is used for response when there is a natural disaster. We give it in 2 tranches. It totals to $350,000. And it helps countries to tide over the initial problem before other mechanisms kick in and bring more funds.
And we saw the CRF in action in Nepal.
Oh yes, this was the first time. We've used the CRF almost 25 times in our region ever since it was established in 2008. And this time in Nepal, it was the quickest disbursement of CRF. We could help the country within 6 hours of their request on the very first day with CRF. So I do feel that this is a very good mechanism by which countries are helped, how we can augment their own investments in emergency preparedness.
And it's an example of an innovative way of investing, of responding and making funds available to a country right after the disaster within the first few days.
That's very true. Also, after the tsunami, we had a number of lessons learned workshops, and in these we developed 12 benchmarks. These benchmarks are supposed to test country capacity and to guide the country also, and to tell them how prepared they are for a disaster. Very often they believe they are, but when you go through this assessment, they realize that they are not as prepared as they should be. These 12 benchmarks of ours were also adopted by certain universities around the world. They became extremely popular, and we use these for assessments of countries to see and to guide countries in their preparedness efforts.
Dr. Khetrapal Singh, you have been an advocate for more investment in preparedness, especially since the tsunami when you were leading WHO's response in the region. I want to come back to you and talk to you about where do we need investment, what are the gaps and what are the challenges in getting investment in which phase of emergencies. But first I'd like to come to you, Dr. Moeloek. Indonesia has faced several emergencies. The tsunami was certainly the most in highlight, most in news, but you have faced several emergencies since then. You have prepared, Indonesia has prepared your communities and your health systems for emergencies. Could you please tell us about the initiatives you've taken?
Yes, I think as Dr. Poonam says about Indonesia, Indonesia is a very big country, and then we are very, so many, after, not the tsunami, but the other earthquake, maybe volcanic, and everything can happen in Indonesia. But after the tsunami that Indonesia established, we call it BNPB, that's a national agency for the disaster management, a specific institution for further strengthen our early warning mechanism and disaster management, rapid response. In order to accelerate and bring the function of the health assistant closer to the public in the event of disaster. And MOH has established in 9 regional and 2 sub-regional health crisis centers, which are located like in the West Indonesia in Medan, in Sumatra, Medan, Padang, Palembang, it is in the South Sumatra, and then Jakarta, and then Surabaya, it is Java Island, and then in the Kalimantan, and in Bali, Denpasar, and then in the North Sulawesi, Makassar, in the North Sulawesi and South Sulawesi, and then in the east of Indonesia at Jayapura. That's, I think we, and at the regional level, Indonesia has built constructive collaboration with our neighboring country within ASEAN. Okay.
I want to talk a little more about how the countries of the region are coming together to make sure that we invest in the right places in preparedness. Dr. Phusit, I want to come to you. Thailand has just contained and dealt with a situation where there was an imported case of MERS and your health systems were put to test. Tell us how your investment in preparedness paid off during that experience.
Thank you. Actually, after the tsunami in 2004, I think that this is a starting point that our government give priority to the natural disaster. And we also, like Indonesia, we established a National Institute for Emergency Management at the national level and try to build up capacity at the local level and also at the national level as well. So natural disaster and emerging threat from virus, for example, Ebola virus, and recently on MERS-CoV is the priority, and our government gives the priority by contributing to this preparedness and response as one of the CCS program under the collaboration between WHO and many agencies in Thailand. So this is preparedness and response and investment from the government in Thailand that we try to build up our capacity and try to invest more in health system preparedness and response to cope with this threat. And for the recently on MERS-CoV, yes, we have a imported case, and from this our investment, we can quarantine, we can investigate, and we can contain the spread of the disease, not spread from this imported case, and we can quarantine and treat this case properly after we can diagnose this imported case on MERS-CoV.
In fact, during that imported case of MERS-CoV, we saw that Thailand was able to communicate the risks to the public very effectively,
yes,
and contain the panic and make sure that public uses changes their behavior.
Yes, right. That's correct. I think that we learn from our neighboring countries as well, because we get many information and perhaps suggestion and recommendation from WHO and from neighboring countries in ASEAN plus 3 countries, because many countries in this region we experience with pandemic of EID and emerging virus like Ebola and MERS-CoV. So I think this is a strength and advantage for investing in preparedness and response to this emerging threat.
Dr. Khetrapal Singh, I wanted to come to you. How has WHO and member states, how have they come together in the region and helped in investment in preparedness?
Let me answer your question with an example. Let's look at the recent example of Nepal and the earthquake. All member states of our region were extremely helpful and came forward to help the government of Nepal in handling this crisis. There were medical teams which came from many member states of our region. There was a lot of equipment that came through. There were offers of medicines which came through and which helped the country to tide over this crisis. We have seen normally that there is a lag between the time a disaster strikes and when national mechanisms kick in. There's always a lag of almost 4 to 5 days, and that is the time when we use our own mechanisms in the regional office to see how we can help. In the earthquake in Nepal, we saw that there was the CRF, of course, which we released, which I just mentioned to you. Besides that, there were emergency health kits which we could immediately provide to the government. There were 4 kits already lying in Nepal which we had used for simulation exercises. One health kit can take care of 10,000 people for 4 months. So therefore, these 4 kits immediately helped the government of Nepal. Besides that, we could send a lot of our staff to help. So what we did this time was to immediately send epidemiologists, disaster-trained people. We could send some public health experts. We could send communicable disease experts, and from the regional office, and besides that from the country offices. And in choosing people who went there, we were particularly careful to choose those who were sensitive to the culture of that country, who knew the language of that country, so that they didn't waste time in coming on board with the needs of the country. So our Nepalese staff all over the region, whether they were based in Indonesia or DPRK or Thailand, we just sent them there. And the countries were cooperative. Our WRs were very cooperative. They went there immediately. They helped at the periphery. So that's how I thought that we could tide over a crisis together, both WHO and the countries. And Nepal was one good example because it's the latest example of an emergency situation in our region.
Well, Dr. Khetrapal Singh, I want to open it up and also ask you and our other panelists this question. When you ask for investment in emergencies, whether it is for the prevention, reduction of risk, for the response phase, or for the rebuilding phase, where do you see a reluctance or gaps in funding, and where would you ask for more funding from our funding agencies?
Well, my normal experience in emergencies is that we do get funds for response. Response is what attracts the greatest funding. However, we do not get funds for preparedness, and that is where the problem lies. We do need funds for preparedness to prepare countries to be able to handle disasters. And therefore, this is an appeal to our donors, if they are watching, that it's extremely important to be able to help countries in that stage to prepare them so that when a disaster strikes, we really do not have to, at that stage, get to donors to help us. Countries should already be prepared to be able to handle an emergency situation.
And when we say invest in preparedness, it seems to be an intangible in a sense, which is probably why it's not easy to get funding. Exactly what are the nuts and bolts? What are we asking for in preparedness?
I think that investing in preparedness, not only money, but perhaps is investing in capacity building and communication, and perhaps money is just one factor or one contribution. For example, after the Nepal earthquake, I think that in Thai society we have quite sympathize and sympathy, and we have the feeling of unity with Nepalese people and Nepalese government, and I think that the government try to allocate and mobilize resource from the private sector and from the Thai citizens, and we found that we can mobilize a resource more than $1 million in a short period, and we can send emergency medical team to help Nepalese people during earthquake. And I think this is an example that it's not just money, but it's perhaps is knowledge and capacity and preparedness in the governance structure and service that we can contribute to our own country and perhaps neighboring countries as well.
I think that not only the money, but I think there's many we can do it. We can get the fund from the private sector, and then the most important is already has been organized. That's very important with from the WHO, and then I think that we can sharing information, experiences. That's maybe the point we can do work together at the moment.
So, agreeing with both my previous speakers, I would also like to point out that there are certain components which need to be attended to, for example, infrastructure. Now, when there is an earthquake, we do need retrofitted buildings. We do need earthquake-resistant buildings. And we have seen in this recent earthquake that the 6 hospitals that were in Kathmandu and which were already retrofitted did not collapse when the earthquake came, and therefore they could give services. And this was really after WHO had put that great pressure on safe buildings when we were talking about safe health facilities. But the buildings which were at the periphery in Nepal were badly affected, and they demolished, and therefore they could not give the kind of services which they normally would have. Therefore, this is something which comes under preparedness.
Right.
We need to prepare our countries and to see that buildings will be able to withstand, an earthquake of this velocity which comes. Then trainings for staff. I agree that capacity building is so important, but for capacity building, we need to have simulation exercises, we need to prepare our staff, we need to have mock exercises so that they are ready for a disaster. They should know what exactly to do.
Right.
If an earthquake comes or a flood comes, what do people do? In these situations, we've seen that the most vulnerable are the older people, small children, women who are pregnant, women who are lactating. They really become a big issue. In this flood, in this earthquake, we saw that the able-bodied men could really get away, but women could not, and the older women especially, and the older men could not, children could not. So we have to think of that too in advance. What do we do when a disaster strikes? Then we do need medicines. We cannot overlook that fact that when there is a disaster in a country, medicines, diagnostics, safe water, all this is needed. Sanitation becomes a very major issue in disaster situations. That has to be thought of in advance, what would happen. And we do have makeshift arrangements for sanitation, but it becomes a challenge. I did see when I went to Myanmar after the cyclone, I saw over there that the sanitation facilities, the toilet facilities were far away from the tents where people were staying. So when women wanted to use these at night, it was a huge challenge for them. Safety became a big concern for them. All this is part of preparedness. We need to prepare well in advance that if there is a disaster, what do we do? Now the benchmarks that I referred to, Vismita, are all preparedness. And they are preparedness on different components. How do countries really get ready for a disaster? And agreeing with both my previous speakers, best practices become very important there to share what a country has done in a situation like this, like Bangladesh's flood control methods have been shared with other countries. And we know that Thailand's infection control methods countries are looking at. Similarly, for Indonesia, the way they handle earthquakes and don't panic each time there is an earthquake. I mean, that is something that other countries can learn from. So there are lessons from each country that can be learnt by the other, and that is what we try to share in our lessons learned workshops.
So there you have it from leaders in health about the need to invest in every stage of an emergency, from prevention to rehabilitation and rebuilding. And thank you very much to our panel, and we'll see you next time.